Being here. My name is Aphrodita Bitucci. I'm the Executive Director of the DTH-Lab. We are a research organization and a consortium based out of Geneva, Nigeria, and India. And we work at the intersection of digital transformations for health and well-being of children and youth. With that said, I would like to start today's convening and invite all of the panelists to the forefront. Would you like to come now, please? I'm not sure if everybody is here, so and then I will introduce you one by one. So I'm afraid I've done this a bit quicker because we are 10 minutes late, so I'm just speeding things up a tiny bit. So thank you, everybody, for being here. I'm delighted to welcome you on behalf of UHC2030, OECD, WHO, CSEM, Transform Health, GIDH, and Asian Development Bank, as well as DTH-Lab. So today, we're pleased to have you here for the launch of the Strategic Narrative, which will drive advocacy and action on digital transformations of health systems for universal health coverage. So a little bit about the event today. We're gathering at a pivotal moment for global health. As we all know, this is no news to anyone in this room. It's a world marked by growing inequalities, conflict, climate shocks, economic uncertainty, and rapid technological change. And health systems everywhere are under terrific pressure. At the same time, digital transformations are present, and there's an unprecedented opportunity for us to use these changes to strengthen health systems and accelerate progress towards UHC. But these digital transformations are not enough. And without intentional efforts on equity, trust, interoperability, governance, and inclusion, we risk reinforcing those existing inequalities. So the purpose of today's event is very clear. We're all here, and I believe here at this panel and those attending are aligned around a shared vision for action, with practical messages and concrete recommendations to help ensure that digital transformations strengthen equitable, people-centered health systems and advancing UHC. So the strategic narrative that we are launching today, and which you'll hear about more in detail from Bethany, Kate, and Melissa later on, is both a practical advocacy tool and a call to action. It's been informed by consultations, workshops, governments, parliamentarians, civil societies, youth groups, technical experts, and global partners across regions. So we will have today's agenda hopefully on the screen. Can you please move to Thank you. So we're going to start by framing today's discussion to officially launch the narrative. And we were honored to hear from a distinguished group of keynote speakers that will bring perspectives from global health leadership, digital transformations, and governance and health systems policy. So Pamela, I don't see Pamela Cipriano. She's online? Yeah? Okay. So we're going to welcome Dr. Pamela Cipriano, who's the co-chair of UHC 2030. She's a globally recognized nursing and health policy leader, and she's long championed equitable and people-centered, thank you, and people-centered health systems and universal health coverage worldwide. We'll also hear from Dr. Amani Siam. She hears well. Where's Amani? Oh, she's not here yet. Oh, she's coming, yes. No, because I know Amani, so I know what she looks like. Thank you. I just couldn't place her. So Dr. Amani Siam, she's a demographer and biostatistician and serving as unit head for health information, digital health and AI at the WHO CRO office. And we are finally here also welcoming Francesca Colombo. She's the head of the health division in OECD, and she leads OECD's health work on health systems, resilience, health financing, and digital health policy. So hopefully with Amani, Pamela, and Francesca, a very nicely gendered panel, I'd like to say, we hope their remarks will set the scene for today's conversation on how digital transformations can strengthen equitable health systems and accelerate progress towards UHC. So I believe Pamela is online. Pamela?
Yes, thank you, Aphrodita. You can hear me okay?
Yes, very well, thank you.
Great. Well, good morning, good afternoon, and good evening to everyone joining us around the world, and certainly to those in Geneva at the World Health Assembly. It was great to see some friends in the audience and many other great UHC champions. It's a privilege to address you in my capacity as the UHC 2030 co-chair on this exciting occasion. As you know, UHC 2030 is the global movement to build strong health systems for universal health coverage. We bring together diverse voices and perspectives for the common goal of achieving UHC, sustaining momentum around UHC commitments, and supporting collective action and accountability. Now, also, as you know, UHC is one of the most powerful tools we have to improve lives, ensure the right to health, and advance sustainable development. But the other thing, as you heard Aphrodite say at the beginning, there are persistent inequalities that are a fundamental challenge for achieving UHC. So it really comes down to assuring the political will to translate the political declarations that have been made into tangible commitments and measurable actions that result in people everywhere having access to quality health services without financial hardship. Despite the progress by countries making a commitment to strengthening primary health care in UHC, as we speak, 4.6 billion people around the world still lack access to essential health services, and over 2.1 billion face financial hardship when paying for health services or products out of pocket. As alarming as these figures are, they don't fully capture the scale of inequalities, both between and within countries. It is the people who are already in vulnerable situations, particularly those in low and middle-income countries, who are most affected and often forced to choose between healthcare and other basic needs. We also know that more than 1.6 billion people already experiencing financial hardship are being pushed or pushed further into poverty because of healthcare costs. So we are at a pivotal moment. The sense of urgency is growing, not only because the original target for all of the SDGs was 2030, but more so because ensuring UHC for everyone, everywhere, is fundamental to more than, quote, health for all. It's a driver for gender equality and women's and girls' empowerment, universal access to education, providing decent work and inclusive economic growth, and eradicating poverty in all its forms, as well as other important global health goals. Health for all is paramount for ensuring the world can fully benefit from scientific and digital innovation. And health is fundamental to stability and international security as the world shares intercontinental crises and shocks every day. In our increasingly connected world, access to health services should be universal. Digital transformation presents a powerful opportunity to reshape how health systems are designed, delivered, and experienced, with the potential for helping close these equity gaps, extend affordable services to underserved communities, and strengthen accountability. Digital technologies can support more people-centered, equitable, and resilient health systems when guided by UHC goals. But technology alone will not deliver the equity that's needed. We need deliberate action to ensure digital technologies and tools are, in fact, designed, implemented, governed, and regulated to ensure digital transformation avoids the risk of reinforcing existing inequalities, but in fact, accelerates UHC progress. In September 2027, world leaders will come together again at the next UN high-level meeting on universal health coverage to reaffirm commitments to achieving UHC by 2030. This is an important opportunity to align UHC, digital health, or broader digital transformation efforts around a shared vision rooted in equity, rights, and inclusion. The outcome will be an ambitious and action-oriented political declaration, not just a repeat of previous ones. And so we want to be sure to leverage digital transformation and artificial intelligence to accomplish these goals. It's in this context that UHC 2030 and our partners, WHO, OECD, Transform Health, DTH-Lab, and CSEM, are proud to launch the UHC's 2030 Strategic Narrative to guide advocacy and action on digital transformation of health systems for universal health coverage. Grounded in both lived experience and technical evidence, the narrative brings together focused and actionable advocacy messages designed to empower stakeholders across sectors to build political momentum to drive timely change that, in fact, will accelerate UHC progress. This narrative aims to equip advocates with common language, clear messages, and practical actions and entry points to engage decision makers. It also brings together UHC, digital health, and broader digital technology advocates to champion digital transformation of health systems, which is grounded in equity and rights. And lastly, to serve as a bridge between global commitments and national implementation. The UHC 2030 Strategic Narrative gives us a tool we can all use to push harder, speak louder, and act faster for health systems that truly will leave no one behind. We're pleased to share the narrative with you today, which we have co-created with you, our partners. We now invite you to make it your own and take it forward in your advocacy. This is ultimately about ensuring that digital transformation serves people and not the other way around. Thank you.
Thank you, Pamela, for that intervention. And next we'll go to Dr. Amani Siam. Hi, Amani, and welcome back to Geneva. I mistakenly said you were from CRO, but I understand you're Geneva now, right? Oh, okay, please.
Good afternoon, everybody, and welcome again. And my sincere apology for being late, despite my excellent GPS instincts. I still managed to go to the wrong place. It's an absolute pleasure to address you today. My name is Amani Siam. I'm naturally the unit head for health information, digital health, and AI. And today I'm actually addressing you on behalf of Dr. Alain Labrique, Director of DDA. And I send you his apologies that he could not be here, but we have a nice set of remarks that can actually help us articulate the vision forward that we have as WHO DDA. So thank you for joining us today. And on behalf of the World Health Organization Department of Data, Digital Health, Analytics, and AI, thank you for joining us. Our director, Alain Labrique, as I mentioned, sends his regrets that he couldn't join us, but wishes to share his support for this important event today. At a time of global uncertainty, today's presentations and discussions demonstrate that we can achieve when we can come together. As you just heard from Dr. Pamela, and I am sure many of the panelists will also argue for the same, we are at a defining moment in global health. Digital transformation has moved from aspirations to necessity. Yet, as we accelerate forward, we are reminded forcefully that digital health and data systems are only as strong as the foundations they are built upon. Since March of 2025, over 40 countries have reported major failures in their national health information and digital service delivery systems. These are not isolated events. They represent a systemic vulnerability exposing how fragile essential digital infrastructure can be without proper governance, investment, and long-term planning. All essential components of what we address as resilient local ownership. Too often, the focus has been on flashy front-end solutions and short-term results. These have political value, but seldom build long-term resilience. But when infrastructure is weak or fragmented, governance is inadequate, local capacity is lacking, and external dependencies are high, systems fail silently until it's too late to act. Data becomes inaccessible, services are disrupted, and the people we serve are the ones who bear the consequences. This is not just a technical issue, it's a governance challenge, a capacity gap, and ultimately a question of equity. As those who can at least afford to be impacted by these failures suffer. They suffer consequences such as disruptions to care continuity, where a patient living with HIV fails to get results or treatment. Disruptions to essential services like antenatal care, or even death when patients' files are lost in the digital ether or when cloud services are interrupted. Resilience in digital health begins with well before technology enters the clinic. It depends on national strategies that are owned, aligned, and financed. These are the three elements that we would like, of course, to stress our discussions on. It depends on legal and regulatory frameworks that protect both systems and people. It depends on standards, interoperability, terminology, architecture that allow systems to evolve and scale without collapsing under their own complexity, and most importantly, systems that are affordable without vendor lockings. And it depends on building platforms that are responsive to health workers, policymakers, and most importantly, the individuals whose health journeys we are trying to support. Digital tools can help us close gaps in access, continuity, and accountability, but if systems are fragmented, uncoordinated, or based on vendor-driven architectures, they do not scale. Worse, they risk reinforcing inequities and inefficiencies that digital was meant to solve and bridge over. WHO is working side by side with member states to change this across the three levels of the organization. Through the global strategy on digital health that we are shaping currently, we are helping countries define their pathways, articulate their priorities, and implement foundational reforms. As part of the ongoing renewal of the strategy, member states, partners, and communities are calling for a strategy that recognizes the continuity between data collection, data curation, and data use for service delivery, resource planning, and policymaking. Digital health and data cannot remain a parallel track of thinking and investment. It must be integrated into health systems planning and financing, workforce training, and service delivery at every level. Why? Because we are accountable to communities. We must measure progress and impact, and we need data and evidence to inform patient care, health sector's plans, budgets, policies, and interventions. What we do now will determine whether digital delivers on the promise or unfortunately deepens existing fault lines. We look forward to building this future together with shared purpose, shared leadership, and shared accountability. And thank you very much for your attention.
Thank you for that, Amani, and thank you for reminding us about the opportunities and risks that digitalization brings, and about the importance of interoperability and standards. And I really like your phrase about digital transformations have moved from from aspiration to necessity. I think that's important to mention. So next we have Francesca Colombo. She's head of OECD Health Division, and she'll let us know about the importance of governance, financing, data systems, and let's hear what she has to say. Thank you for being here.
All right. Well, first of all, I'm really delighted to be here with UHC 2030. I've been collaborating with the partnership as OECD for quite some time, and together with WHO and the World Bank. It's really fantastic. And I must say that we had for several years been saying we must do something on digitalization. And artificial intelligence, both of them. I mean, if you think it's the defining technologies of other times. It's transforming completely labor markets, economies, societies, you name it. And so it's either we jump on board in the right way, or we're going to be losing out, but losing not just from the risks of applying the technologies, but also from the risks of not applying the technologies. I think it has been mentioned, Pamela, you mentioned it quite clearly. There are huge potential. The potential are obviously for access. And if you think what happened during COVID-19, when we had telehealth, was a sort of a necessity, but before COVID-19, only 4% of services was delivered through telehealth in OECD and partner countries. And through COVID, that was unfortunately, because it was a crisis, but it was an impetus for really accelerating transformations. But if you talk more broadly, the opportunities, they're really vast. They're about research and innovation that can help bridging some of the gaps in terms of access to services. It's about more tailored and precision public health services and also primary healthcare services. It's really about people-centeredness of care. So it's really about huge amount of opportunities, but get it wrong. Obviously, we're going to be magnifying, particularly with artificial intelligence, some of the geographical, difficulties in access, and particularly we're going to have a situation in which only those who have the financial capabilities or even the geographical good fortune will be the one that will benefit. So that has been really quite mentioned. So we need to get it right. Now, what we have done at OECD to support the report that will be published and with this narrative is that we run a series of interviews with different experts, digital experts, civil society, governments, organizations on the issues, precisely what are the challenges, what are the opportunities, what needs to be done in a way, and what are the narrative that needs to be brought forward. So those are going to be presented, but from just some highlights from the interviews that we did, they were run into 6 main areas, but I will, for ease, just because it's easier to remember 3 things, just focus on 3. So the first thing that really came across in making progress is the political leadership. And too often we think about technological transformation and digitalization as a technological challenger, and there is. It has been mentioned, I'll say a few things about that. But first and foremost is really about having the political leadership that will lay the foundation for making sure that this digitalization serves the needs of those who are in most needs and ensure that the access is available to all. But that implies in establishing the legal framework, the pathway for responsible use, the privacy respectful use of data. All these sorts of things are really fundamental. There is another aspect of that's leadership, which has to do really with the building of trust in the technologies across different stakeholders, and this has to do both with the people, the users, the populations, but it has to do also with the workforce and the ability of the workforce to use the technologies in a way that is conducive to equity for those in needs and make the most of what the technologies can offer. Most fundamentally, it also means doing this in a partnership and co-engagement and co-development agenda, and that's really fundamental. I mean, it cannot be led by the technology developer, it cannot be the provider, it cannot be just alone the users. It needs to be a co-engagement from the start to the beginning. So that's the first thing, this political leadership. The second one has to do obviously with getting the technical aspects more right. There are many different things have been mentioned, some of them. Technical standards related to interoperability. It's a technical challenge. I think artificial intelligence can help us also, accelerating that, but we need to get that right, making sure that we have the secondary uses of the data which are got it right, applying digital technologies in health financing, making sure that we do that so that there is financing for those technologies in a way that ensure that everybody has access to it. So, and workforce capacities. I think that's another very, very important aspect. And workforce is such a defining, again, element of ensuring universal health coverage, but the workforce needs to come along this digital transformation. And the third element, which is fundamental, has to do more with doing things in compatible way across different countries and across different stakeholders and institutions. So there is no need, and in a way, it's a lost opportunity if we do things in one localities in one way, in another place in another way, without learning from each other and without reaping really the benefits of moving forward towards the goal of universal health coverage. So I'll stop it there, but really re-emphasizing also these needs for cooperations, and in that respect, also the partnership with the UHC 2030 and with all the stakeholders involved. It's a demonstration of the value of that cooperation. So thank you very much.
Thank you, Francesca, very much. And thank you very much for reminding us about the importance of leadership, about building trust, and reminding us also of the resistance to change, which we might, and the need for, yes, we forget about that sometimes. And digital literacy is also important if we want to bring the workforce along too. Yeah. Yeah. So with that said, thank you to all our keynote speakers for grounding us both in the urgency and the opportunity of this moment, because I think we've all mentioned opportunity, and you even mentioned how AI can help us shift some of those challenges that we actually have and address them. So digital technologies have enormous potential to strengthen health systems, improve access to care, but only, and this is one of my favorites, if they're intentionally designed to serve people, reduce inequalities, and build trust. I think that's what I'm sure most of us are aligned on, and this is what we need to address. So to help us better understand the strategic narrative itself and the concrete advocacy priorities it proposes, I would like to welcome the two of the authors of the narrative, Bethany Kate Lewis, who's a technical officer with the UHC23 core team, and Melissa Sederqvist, technical officer with WHO at the at the DDA. So.
Thank you. Just making sure we have the mic working. Wonderful. Thank you, everyone. It's a pleasure to be here today with you all to share the exciting release of our UHC 2030 narrative on digital transformation of health systems for universal health coverage. We're sharing with you today the narrative as a UHC 2030 conference paper ahead of its publication by both UHC 2030 and OECD. So the strategic narrative has been a real collaborative effort between UHC 2030 Secretariat, the World Health Organization, and OECD, in development also in collaboration with some key UHC 2030 partners, so the Civil Society Engagement Mechanism for UHC 2030, Digital Health Lab, and our colleagues at Transform Health. The drafting process has been led by myself and my wonderful WHO colleague, Melissa, who's in the front here, as well as Eric Sutherland as well from OECD. The advocacy narrative has been developed through a process which combined desk review, broad stakeholder consultation, with a really diverse global participant and expert review as well from WHO and OECD technical areas. The narrative has been grounded in the perspectives and the priorities of UHC and digital advocates. From 2023 to 2025, we held 5 consultation workshops with participants from countries across the spectrum of early digital health adopters to new entrants. And the consultations engaged youth, civil society organizations, technical experts, parliamentarians, as well as technical experts on digital transformations from across the UN and international organizations. The objective of the narrative is to support advocates, governments, policymakers, civil society organizations, youth and other stakeholders to push for the implementation of UHC commitments at the national level through actions and sustained investments to strengthen health systems through digital transformation. It seeks to foster widespread and cross-sectorial solidarity and momentum to turn political commitments into concrete health and digital reforms. So the narrative, if my technology actually allows me to scroll up the page. The narrative includes a clear narrative for harnessing digital transformation as a necessary enabler for improving health equity and advancing UHC. It includes 6 key advocacy messages to align partners and guide unified advocacy efforts, and also has tangible actions to help support advocates in driving implementation of the key messages in their national context with decision makers. So I'm now really pleased to be able to share with you the narrative's key messages. So our first key message is about health equity and rights and placing those at the center of digital transformation of health systems to tackle inequalities and accelerate UHC progress. This includes aligning and leveraging prior efforts and prioritizing digital health solutions in primary health care. Our second key message is about ensuring everyone, including underserved communities, can access digital health services and their health data by prioritizing investments towards stable, secure, and affordable digital infrastructure and prioritizing interoperability. Key message number 3 is about protecting everyone from impoverishing health costs by applying digital technologies in health financing to secure efficient, equitable resource distribution and expand financial protection for all. Our next message is about building human capacity, technical skills, and digital literacy, including for health and care workers, to develop and implement and sustain an equitable, standards-based and inclusive digital transformation for UHC progress. Key message number 5 is about trust. So we want to foster trust in the adoption of digital health services and tools by engaging diverse populations, stakeholders, including vulnerable and marginalized populations, in the design, governance, and delivery of digital health systems and solutions, including through mechanisms for social participation. And finally, our last key message is about establishing robust governance frameworks, including legislation, regulation, standards, and policies to ensure health data collection, sharing, storage, analysis, and use improves equitable health outcomes in policies, plans, and budgets while safeguarding people's rights and privacy. I'm now going to hand over to my colleague Melissa from WHO, and she's going to go through and do a bit of a summary of the key actions of the paper. Thank you.
Hi, good afternoon. So as was said earlier, I'm Melissa Sedikistin-Jihia, and it's my pleasure to also take you through now the key actions. And we'll stay on this slide for just a little bit. I'll just remind us around the key actions. So they are, of course, put together, as I think has been said also in the opening remarks, been put together to mobilize political support and to really help drive this change towards achieving UHC. The actions, keep in mind, the actions are not exhaustive. They're not intended to be addressing every issue or every point, but it's the key issues that we've highlighted. So keep that in mind also as you're looking through. They are driving the timely and cost-effective change that we see, that we know can happen with digital technologies if leveraged with standards and in a sustainable way and through aligned efforts. It's also the actions are also intending to avoid exacerbating barriers that we know exist, but also not to create new ones. As we're implementing digital technologies, we don't want to create new barriers that might leave anybody behind. And the last one is just to mention that these actions are categorized in different thematic areas, but they are not exclusive. They are dependent on each other. So as you see them, you might think this action can be placed here, etc. So there are interconnectedness to keep in mind. Next slide, please. So I won't go into detail into each of the 6 areas and read through each of the actions. We'll hope that you get an opportunity to read that in the narrative, but I'll just bring out some of the key functions and areas within each of the actions. So of course, the first one is placing health equity and rights at the center as we move forward in digital health transformation. As we said earlier, making sure that we are not introducing any barriers. We are assessing and addressing inequalities when we are developing digital health strategies and digital health interventions, and also prioritizing person-centered health systems, person-centered digital health systems, because once we put the people at the center, we can also make sure that nobody is left behind. Next slide, please. The second action is around the investment in digital infrastructure and prioritizing interoperability. We need to encourage governments, entities that are supporting governments, partners, etc., to assess what are the infrastructural needs in a specific country and what are the various solutions towards driving digitalization that can be helpful. We need to promote and invest in adherence to interoperability standards, but also classifications and terminologies, making sure that systems within a country can speak the same language, can share data, but also that we can have disease surveillance and efficient decision-making across health systems. Next slide, please. The third action is around applying the use of digital technologies in health financing. So we've seen this, for example, in the Global Health Expenditure Database that has been in place for over 2 decades now, that where you can see health expenditures across these 450 different variables related to financing and consumption, etc. But also making sure that we are looking at what are some of the risks that might come into play as we're introducing digital technologies in health financing, and how do we mitigate those? A common topic in recent days, of course, is the use of AI. So we need to think of that. How are we mitigating possible risk to that? Next slide, please. The fourth is around building workforce capacity. Of course, the use of digital technologies is only as good as we can implement it, and everybody who is using digital technologies, whether they are patients, health workers, planners, and decision makers, need to have various sets of competencies and skills when it comes to the use of digital. WHO is developing a global digital health competency framework that can be leveraged to ensure that those skills and competencies that are necessary for the various groups are there. But it's also important to reference other toolkits that exist for beyond just health, to make sure that the skills that we have within the health system can also connect with the broader digital system in a country. Next slide, please. This is the fifth one, so we're almost at the end. The fifth one is fostering trust. And so, of course, I think we've also heard this in the opening remarks and the keynotes, that trust is a really critical component here. So introducing trust, or making sure that we have mechanisms that enable trust within a digital health system. And ways to do that is, for example, to institutionalize mechanisms for social participation, making sure that there's consistent funding for that engagement, as that then enhances usability and trust of the systems. Engaging vulnerable and marginalized communities continuously in these discussions. And of course, digital health literacy it also creates trust by understanding, where does my data go? What happens to my data? Next slide, please. And the last one is establishing robust data governance. And again, as we said at the beginning, a lot of these actions are also interrelated. So strengthening robust policy and legislative foundations, making sure that we can do responsible collection and use and exchange of health data within a system. That also, of course, is very much linked to trust. So as you can see, all of these actions are very much linked, and I don't think we can work on any one in isolation, but there's much to leverage here. And another one to pick out here is, for example, leveraging existing networks and learning from each other, learning from what the experiences within countries and what what has gone well, and what are some of the challenges that have been experienced that can be learned from. I think that is my last slide. Thank you very much.
Thank you, Melissa, and thank you, Bethany.
roadmap for advocates and, oh, it's switched off, thank you. Thank you, Melissa and Bethany Kate. And I'm sure the group will have the opportunity to peruse the document and look at it carefully, and everything that it will help us build stronger health systems. So now the next on the agenda is the panel discussion. And I must say we have a very terrific and very well-balanced panel now, because we're going to hear from implementers, we're going to hear from policy, we're going to hear from advocates, and for people with lived experience and young people. So I think it's a very well-balanced balanced panel. So before we dive into the discussion, I would just want to briefly introduce our different panelists. Next to me, we have Innocent Chiboma, who's from the Ministry of Health of Zambia. He's the Principal ICT Officer for Digital Health at the Ministry of Health, and he's got over 18 years of experience in digital health. He has been instrumental in spearheading Zambia's digital transformation and building nationwide infrastructure, including the integration of over 12 million patient records. So I'm sure you're going to have a very captive audience here to hear how you are actually doing the work on the ground where it's most needed. Then we had Dr. Derek Munin. Where's Derek? There he is. Dr. Derek Munin, he's the team lead at the Department of Data, Digital Health and Analytics here at HQ. He works at the forefront of global digital health efforts at WHO. He supports partnerships, digital transformation planning, country implementation to strengthen interoperable and resilient health systems. Then we'll hear from Mohammed Osman, who's a Dr. Mohammed Osman, who's a physician and with his lived experience from Sudan. He's an advocate from Sudan, and he's a member of Our Views, Our Voices, the Global Advisory Committee at NCD. Welcome, Mohammed. With Daniel McDonald, IPS Policy Coordinator and Youth Advocate. Youth advocates are always very welcome. We'd love to hear with you, cooperate, and, future leaders. So very important. And he works with IPSF. He's contributing to global advocacy on digital health, workforce competencies, and youth engagement. We also have with us Matilda Forsling. Besides research and implementation, we also need, the communication side of it and sharing information and advocates. And Matilda is the founding executive director of Transform Health, and she's a seasoned advocate and coalition builder. So welcome. And Dr. Akihito Watabe, who's a health specialist and health impact investment specialist at the Asian Development Bank. Dr. Watabe works on health financing, digitalization, and health impact investment at the ADB. See, he was previously with UHC2030, where he supported global UHC incentives. So thank you very much to all of you for joining us and for making the effort to come to Geneva, which is always not always very easy, but thank you for coming. So my first question is for Ministry of Health, Dr. Innocent. So could you just share some of your insight on how digital transformation of health systems is being leveraged to advance UHC in Zambia? And how is Zambia working to strengthen data governance to improve equitable health outcomes?
Thank you very much, and honored to be on this panel. So Zambia as a country is leveraging that digital health transformation. So I like saying that when you put digital and health apart, many times you get the problem, because they're supposed to really be together, because you're trying to deliver health really using the digital transformation. You're trying to deliver services using the digital transformation, and our mind should not be so much on the digital transformation or the digitalization, but more on what services do we want to offer, how do we want to change the lives of our people. And that's when now we think of the digital transformation. That's when we think of the digital tools that we're going to use to deliver that care. So many times our partners and everybody else comes thinking of a tool instead of thinking of solving a problem. So as a country, we have used this opportunity to help deliver care to our people, starting, of course, from the period of the HIV pandemic, using the digital tools like the electronic health record system, Smart Care, to reduce the problems that are found in HIV, the resistance, and so on and so forth, because we were able to track people and able to follow them up and make sure that they are on their medication, and also they are taking the right medication. They're not moving to the next line in case they fail their treatment. So now the system is all around in all the services. So some of the things that we're doing recently, for instance, is trying to have the clinicians' handwriting to be recognized by the system so that they can be able to take the notes easier and speed up the processing of patients. And so really we are using that as a means to deliver care. And because of that, we are able to reduce wastage. We're able to provide care to the patients. We're able to so we're able to what we can say, we're able to provide care to more people than what we would do without that system or without the systems that we have, including systems like the lab information system, the logistics management information systems, the wastage that we used to have in terms of drugs that are sent to one facility and they're not being consumed, and we're able to reroute them to another. But all that happens because now you have the data and the transformation is happening. So with that, the country is also working very closely with the Data Protection Commissioner, and we have a data governance framework, as well as we recently submitted what is called an SI to the Ministry of Justice to be signed off at Cabinet. This is going to be used for health data governance. This is a piece of instrument that is going to be used to manage the issues of data. So maybe with that, I can end here for now.
Thank you, Innocent, very much. I know we are pressed for time a little bit, so I've decided to just ask one question to each of the panelists, and if you choose, so if that's okay with you, just to move things forward. But thank you for reminding us that digital, what is at the heart of everything we do is delivering healthcare, and how we deliver it. Digital is one of those tools to deliver it. So thank you for reminding us of that. So Dr. Derek, over to you now. I'd like to ask you about from the perspective of the global strategy in digital health, which you are working now and refining, what are the most critical foundational investments that countries must make to ensure that digital transformations strengthens rather than fragments health systems?
Thank you very much for that question. So just want to maybe begin by thanking the organizers for this meeting, which is really timely. We are 3 years towards getting to the 2030 agenda. And we know that it's been well articulated that the SDG targets that we're trying to attain can actually be fast-tracked by the use of digital. I mean, the ITU has consistently reminded us that 70% of the SDG targets can be influenced by digital, and then the remainder can be informed by digital. So this is a really opportune moment that we're in. As has been mentioned, the whole journey around the transformation of the health sector, as WHO is really focused on having this global instrument we call the Global Strategy on Digital Health, which is a global instrument that member states, partners, and the Secretariat use to inform the principles of digital transformation in principle, and to enable countries in practice to really translate that instrument into national strategies. And so, as has been mentioned, we are in the process of renewing and reviewing the current global strategy that was really formed on 4 pillars, which are strategy. Every country must have a strategy, governance. Every country must have working arrangements to inform the transformation agenda, and the whole issue around making sure that each country has a focus on people-centered care, services, plus the whole agenda around capacity. And so, from our perspective, delivering on the global strategy requires that each country taps into that strategy, and that all partners align in terms of feeding into the country's expressed journey in national strategies, and then making sure that we're measuring. So the 5 things I'll say quickly on this intervention is the whole issue around governance. So the global strategy that we speak about, including the one that is yet to come, insists that we really must make sure that countries have governance arrangements, leadership arrangements, working arrangements that bring together all actors so that the coordination is effected. The Global Initiative on Digital Health, spoken about by Melissa before, this particular panel, is that instrument that we're using to ensure that governance is in place. And then secondly is the whole issue around foundations. We encourage countries and partners to ensure that foundations are put in place first before applications. So foundations before applications. This is a key issue because we're not short of applications. WHO maintains a repository of country digital health solutions through our Global Digital Health Atlas. We complement this with the database at the ITU, where different actors register digital solutions. There are many, many solutions in these repositories. We're actually not short of solutions. In fact, we are coming from a time where pilotitis, which is the vertical solutions mushrooming, is still with us today. We're really suffering from hepatitis, which is the fragmentation driven by several applications. And so we insist that foundations through the digital public infrastructure journey, as was spoken about, must be focused so as to ensure scale and sustainability. We're speaking about registries, we're speaking about costs, we're speaking about registries for people, health facilities, and etc., as a means by which these digital solutions can feed into those foundations to inform scale. And then the whole issue around making sure that countries' strategies are built collectively. And then fourthly, the whole issue of capacity. So as we know, transforming a sector is 3 things. It's people, it's a technology, and the processes. And so the people skills that were spoken about earlier are critical in this journey. And then lastly, the whole issue of measurement. And so we are in the process of really, demonstrating what is working where, and what can we learn from those applications, and what can we actually take forward. So measurement of the progress that we are all undertaking is critical, and reporting that progress so that we can actually learn and share best practices, and then ensure that we are leveraging on what works. And hence, we invite everybody to the June meeting, where we'll be convening the 3rd Global Initiative on Digital Health convening to share best practices and really chart the way forward through a DPI approach. Thank you so much.
Thank you, Derek. Thank you very much for that. Thank you for reminding us about the importance of leadership. Again, we've heard that from Francesca as well about the governance issues. We've heard about implementation as well. So next we're going to hear from Mohammed Osman, who's representing the World Medical Association, and he's the physician from Sudan. So from you, I'd like to hear about what key lessons or what advice would you like to share for effectively engaging decision makers at the national level?
Perfect. Thank you very much for the question and for the invitation as well. And I have to say that I'm really happy to finally meet Aphrodite in person. We've been exchanging some emails over the past couple of weeks. So it's good to, put a face to the emails. Well, I personally think that I do wear different hats, and sometimes it's really difficult to consolidate all the ideas into concrete and actionable recommendations per se. But let's try to, dissect it together and look at it from different perspectives. I think the first point that comes to my mind is to center people with lived experiences, because we're not talking about a stakeholder who is at the bottom of the list. We're talking about someone who's actually experiencing the reality every single day. And to look at digital transformation and UHC, this is not a buzzword, it is a lifeline. And, to maintain continuity of care, that is incredibly important. We've seen in the past 5 years since COVID and then all the geopolitical situations, that without telemedicine and without access to digital health and infrastructures, at some points we lose touch with the patients. And again, it basically costs them their lives. So bringing the voices of those with lived experiences, those who are living at rural villages, remote cities, those who are struggling with everyday access to healthcare, it is incredibly important. The other point that I also have in mind, and it's very relevant to the new narrative, which is the institutionalization of social participation. Again, like I've mentioned youth, I've mentioned people with lived experiences, but there are other groups that are also experiencing different realities, experiencing different disparities. I am a young person as well, and I know that being a young person in this like a world and age, it's not easy. You do have different challenges. You have to deal with bullying, online bullying, not even like the regular kind of bullying. You have to sort of make sure that you're always updated. You have to learn. And this is just one other group besides people with lived experiences that has to be included. And I guess if I ask the audience, for example, they'll all come up with at least one other group that also needs a seat in the table. So I think to just sum it up, like social participation is key, especially when it comes to matters that pertain to people's lives. The last point, and I guess over the past couple of days, and maybe it is also something that will come up multiple times during this World Health Assembly, is the data rights and data protection and data sovereignty. And I guess from my perspective, there is a single point that I would like to put forward, which is investing in nationally owned analytical pipelines. Each and every single country has the right to decide what's best for their people. Taking into consideration their different realities, taking into consideration their language, taking into consideration their level of education, and making sure that all this is centered, like basically a people-centered approach. So to assume that everything is going to happen globally and then somehow it will magically appear in our countries, that does not happen. So it is always important to emphasize that countries need to step up. Countries need to take control of their own narrative and make sure that they're actually serving the people they represent. And yeah, I guess I'll rest it for now.
Thank you, Mohammed, for that. And thank you for reminding us of the people or human-centric approach that we need to include all stakeholders. We need to make systems representative for those that are using them. And with that, I'd like to segue to Daniel, who's here from IPSF, and he'll be speaking to us about workforce. That's one of your strengths as well. So, but in this case, I'd like to ask you, what do policymakers need to hear right now about strengthening health systems through digital transformations? And if you can bring like a workforce perspective into that as well, that'd be great. Thank you.
Perfect. So again, I want to share a massive thank you for the invitation. I think as a youth representative in the room, it's just such a special experience to be able to share our lived perspectives. Everyone here in the room was young once, and I know that I will go on to achieve great things. And I know so many people in this room have done the same thing. So I really, really want to thank you for the opportunity. So I come here representing the International Pharmaceutical Students Federation, representing over 500,000 pharmacy students and recent graduates all across the world. I'm also a recent graduate myself, working as a pharmacist in the community in my hometown in Wales, and really do feel that universal health coverage is probably something that I see and maybe take for granted on a daily basis. Working in the UK, we do have free access to healthcare at point of care for pretty much all of our patients. It, of course, comes with its challenges. And what I'm really seeing now in this day and age age is the fact that digital health systems are changing rapidly, and it means that the future workforce are having to make so many different changes to their practice, which is really great. We're learning so much, but it is also important, as has been mentioned by everyone so far, that we're focusing on how that impacts real people, real patients, who are essentially getting the support from us as healthcare professionals. So in IPSF, we have a global policy topic focus every year. This year, our focus is on AI in healthcare. Last year, it was actually universal health coverage, and the year before, digital health. So each year, we have been really focusing on these three themes, focusing on all of our member organizations coming together, drafting policy statements, and they will then form our global declarations that are approved in our General Assembly. And I think the message that we're really getting across is the fact that pharmacy students, they really want to see that education is changing, that it's keeping up to date with all of these advancements and developments in digital health and in universal health coverage. And again, as mentioned, that it is tailored towards those local needs. In IPSF, we've delivered over 1,300 projects last year surrounding public health, pharmacy education, and professional development. And the themes of universal health coverage are through line everything that we do. And it's so important that as the youth, we are really showcasing that perspective. So in terms of the key takeaways, definitely it's about ensuring that the work that we're doing is equitable, of course. But what does that mean? It means that no matter who you are, no matter where you come from, your age, your gender, your nationality, your sexuality, anything of the sort, that you can go to your healthcare professional in your local community, whether that is your pharmacist, whether it's a nurse, a doctor, a paramedic, and that you feel that you can access healthcare without fear of judgment. That's the ultimate aim. And I think that digital technologies and the advancements, although maybe it feels that that is a big focus, I think what that means is if the digital systems are working properly, that then means that we actually will have more time to focus on real patient-centered care in practice, because some of the administrative tasks like documentation, which is incredibly important, can sometimes be slightly more automated. And I think that that is a really big value of moving forwards towards the digital health that we're aiming for. So some of the key messages that have come up in our policy declarations in IPSF include focusing on the generational technological divide. I think that this is definitely something that we will see that maybe some of the older populations might feel as though digital technology is holding them back, whether that's in terms of access to healthcare, whether that's in terms of access to information. You'll also find a lot of misinformation that is out there. And I think that that is a big focus that we're advocating for, is that we're having materials and having training that does encompass everybody. I think on top of that, it is about data security, data protection. So with a big drive towards digital health, that will also mean that we have to make sure that these systems are fully secure and protected. And in terms of the final, so 3 lessons that I would say towards any decision makers that are in the room or listening. So firstly, it's crucial to work with universities to embed digital health into the education healthcare systems that will then go on to shape the future workforce. Secondly, to access expert advice in local communities, and again, as has been mentioned, those with lived experiences. It's so crucial that the data and the feedback that we're getting comes from those that use the technology firsthand. And thirdly, and finally, the importance of including young people and youth as part of these decision-making processes. At the end of the day, it's our future, so let us be part of assessing it. Thank you.
Thank you, Daniel, for those words. And thank you for reminding us about the importance of including young people. As it's been mentioned before, we need to include everybody in the design and the consultations of of everything that we're proposing to do. So next, I have a question for Matilda, who's the CEO of Transform. She's the executive director of Transform Health, sorry. And you've heard from the implementers and researchers and the policy people. So now I would like to ask you what key lessons, because you've done a lot of consultations and you bring together big groups of networks, etc. You're a network builder as well. What key lessons and advice would you like to share for effectively engaging decision makers at the national level?
Yeah, thank you, Afrodita, and thank you so much. It's so exciting to be here. I want to say thank you to all of our partners that we've been part of developing this narrative. It's been a journey and it's taken some time. So it's very exciting to be here and finally see this product in front of us. So advocating for the digital transformation of health systems for UHC is really at the core of our mission at Transform Health. And we are a global coalition of 230 organizations dedicated to achieving universal health coverage by harnessing digital technology and the use of data. And we really advocate and strengthen the enabling environment. So we work on laws, regulations, we work on policies, we work on the financing and coordinating structures to ensure that digital transformation is equitable, inclusive, and sustainable. And we bring together different actors, leveraging our shared experience and expertise to shape policy agendas, influence decision makers, and develop tools and provide technical support. And a key priority for us, as well as many of the speakers here, is also to really give space for young people, women, and marginalized communities to engage in these conversations and really be part of the decision-making processes. So I would like to flag two of the things that we have done at Transform Health recently to advocate and support the digital transformation of health for UHC. So in 2025, we launched, at the end of the year, we launched a new roadmap to 2030 that is really designed to take us from kind of strategy to more coordinated action at the national level. And this is a 5-year multi-stakeholder plan to accelerate digital transformation of health systems and to make progress towards universal health coverage. And this is really grounded at the national level. You know, we don't need another global framework, or, you know, we really need to take collective action at the country level. And that's what we are aiming to do with this roadmap to 2030. So we're setting up kind of working groups at the national level that are driving against 5 specific goals that we have specified or highlighted in the roadmap to 2030, and bringing together multiple stakeholders to really drive the transformation together collectively. The other thing that I want to highlight is our new youth call to action. We will have an event in the coming days where my colleague Cesar, who is at the back here, will be speaking more to this. But the youth call to action is really an equitable, inclusive, and rights-based digital health call to action that has been designed by young people. So to answer the question that Afrodita asked, what are some of the key lessons and advice that I would share for effective decision makers at the national level? I think we need to really lead the health problems. We need to lead with the health problem and community needs, not the technology. Decision makers in health, I think they really respond to coverage gaps. They respond to workforce shortage and political priorities. And therefore, we really need to anchor this conversation in national health plans and priorities and UHC service coverage data, not talk about digital solutions. We also need to find cross-ministerial champions that is not just in the Department of Health, but we need allies in finance, in ICT, and also in the presidency and in the Prime Minister's office to really see this sustainable transformation that is required at budget lines, in legislation, which requires, you know, champions beyond just the health sector. And we need to treat civil society as a key stakeholder and governance actor, not just as a beneficiary. We need to meaningfully engage young people, women, marginalized communities to build trust, because that's a precondition for acceptance and adoption of digital tools. And civil society is really capable to monitor and implement and hold governments accountable to what they have committed to. So civil society to us plays such a crucial role. And finally, I think global commitments needs to be anchored in at the national level, in national accountability. So when governments have already endorsed the WHA resolution and the global strategy on digital health, or the Global Digital Compact and the UHC political declaration, civil society can really use those commitments to demand national level action and implementation. I'll leave it there. Thank you.
Thank you, Matilda. Thank you for that very comprehensive discussion. Is Akihito online? You see?
I'm here.
Oh, yeah. I'm sorry. I was thinking, where is he? Where is he? Thank you for being here then. Where did you come from? I hadn't seen you earlier.
From Indonesia.
Well, there you go. That's my answer. Thank you so much for being here. So my question to you, Akihito, is you're going to speak to us from a health financing perspective, which is crucial to everything that we want to do and what we hope to do, both in involving different stakeholders, communities, implementing, etc. So with that said, how does the digital transformation of health systems align and influence your work, the work that you do?
Thank you very much. And first of all, thank you for organizing this event. And on behalf of the steering committee of the UHC2030, ADB is a part of the group now. And also I'm a former UHC2030 core team. That's happy to be back to the work. So in terms of financing, so there are two different financing, like financing digital technology and digital transformation, and also how we use the digital technologies and the innovation for health financing operations and making UHC achievement. So first of all, I'd like to talk about health financing, so using digital technology for health financing, like improving health insurance operations, how we making this health financing operation is more efficient, and also how we can use a limited budget to achieve the outcomes. That's a critical moment, critical target. And we see digitalization is critical in terms of the achievement UHC. Without the digitalization, lots of work, paperwork, and the data not available for the strategic purchasing or benefit package design, the costing of the tools. A lot of things, many countries are already setting up the UHC schemes, like setting up the health insurance fund or national health insurance scheme. But then they are struggling to, prepare the longer term sustainability of the system and how we can bring the additional services and whether it's sustainable to bring the new technology, new services as part of the UHC. So data is critical, and also acquiring data is critical in terms of the UHC achievement. So that's why ADB is also providing some technical assistance to identify new technologies, innovation, or case studies from other countries, how digitalization can help the health insurance operation or UHC schemes. That's what we are doing first thing. And then financing digital transformation, that is another agenda. That's a digitalization. As you know, the ADB is one of the multilateral developing bank. We work across the sectors, not only health. But the digitalization is one of the cross-cutting and top priority agenda in ADB. So that we have a digital team supporting the different sectors. So we provide a loan to the government as part of the health system reform. We always include a digital transformation agenda as part of the investment. That is a critical component. And we bring the digital experts to the health team so that they can help, because we are not digital experts, and we need to make sure that our goal is to achieve the health outcomes, right? Not the digitalization itself. So we bring the different expertise to make sure that our new technology innovation would achieve the ultimate outcomes of the project. So that's the way that we're helping the countries. And we are also increasing the digital time investment type of loan as well, not just bringing the health digital transformation as part of the health project, but also we recognize the investing in the public infrastructure, the digital public infrastructure. The base of the digitalization is critical, not just a small applications or small tool. That we need to connect the data between the health and other sectors, or between the national and also district or community level. So we need to have the investment beyond the health sector, that we need to work with other. So that we also have some investment of the digital DPI, digital public infrastructure, so that we can help the digitalization is also contribute to the health agenda. Then, of course, a new area for the AI, artificial intelligence, that's also a new investment. We are exploring how the member country can use AI for health operations. That's also a new area for us, and we start working with the WHO and some other agencies to how we can regulate AI, but also how we can bring these innovations and how to help the ownership of the data in the country to use the AI for a meaningful way. So there are many things happening for now, but yeah, we're happy to talk about this more in the next event that we have with the Transform Health as well next. Yeah.
Thank you.
Thank you.
Thank you, Akihito. Thank you very much. And I think from the points I take from your discussion is you reminded us of the cross-sectoral connectivity, that health doesn't exist in a vacuum somewhere, but we need that digital infrastructure to exist. So we'll need all ministries to actually be involved. And also it needs to be, besides a cross-sectoral, multi-stakeholder collaboration. So thank you for that. I know we are, as I said earlier, we're a little bit pressed for time. Before we wrap up, I'd like to ask each of you, and just one short sentence, if you will, like, what is your main call to action for advocates and decision makers in the room today? And I'll start with you, Derek, if you don't mind.
Thank you so much, and I'll be brief in my remarks. So the one key action for policymakers is around ensuring that each country has articulated approaches towards digital public infrastructure and the whole journey of the digital health transformation. That is key for sustainability, for scaling, and also for making sure that we leave no one behind using digital. Sorry, that is more than a short sentence.
No, that's a good sentence, though. It's needed. Has to make sense. So it's a good sentence. Thank you. Over to you, Donald.
Yeah. For me, I think the key message would be about ensuring that we have representative decision-making so that everybody is included in the conversations, whether that is those that use the technologies, those that develop the technologies, and that we have a breadth of diversity in our decision-making. Thank you.
Thank you, Daniel. Innocent?
Thank you. For me, I would say decision makers should make sure that they invest in leadership from the top all the way to the bottom. Digital systems do not work by themselves. They work because there are leaders who drive them. So at facility level, at provincial level, at district level, at national level, if you have systems, they work because there are people who are leading them, not just because the application is a good thing. So if you don't invest in people, systems will crumble. Thank you.
Yeah, thank you. That's a good reminder. Last one.
Digital health transformation, which is meant to increase access to healthcare, can actually deepen inequalities if the particularities of different countries and groups is not taken into consideration.
Thank you. And I'd like to thank the panel very much for this very rich discussion. I would like also to thank UHC 2030, Bethany, Kate, and Melissa for inviting me today and allowing me to moderate. And also on behalf of DTH-Lab, it's been a proud journey and happy journey to be with you and to support you in drafting the narrative and launching it today. So with that said, I'd like to, fortunately, I have to go to my next event And that's my alarm, so I apologize. So thank you for being such a good audience. And I'll leave you in the hands of Melissa and Bethany Kate. And Laura. Oh, I'm sorry. Can we just have a photo with the panelists, please? Would you, Amani? Francesca? I have a question for you.
Okay, nice.
Oh, thank you. It's my first to be here.
Francesca. Yes, shifting over there. We're moving to the side. Shifting. We can like this.
Again, move further.